Every 100 children are living with cerebral palsy. However, it's always a challenge for parents who raise such children, with many complaining of stigmatization by the society. Josh Ansari spoke to such parents and medical experts to understand the condition and filed the following report, Living with Cerebral Palsy.
Cases of cerebral palsy among children are on the rise in the country. At least 3 children in every 100 are reported to be living with the condition globally, according to health experts. Living with a child suffering from cerebral palsy can be depressing, especially in a society that is not accommodative.
At 6 months, my son was not sitting, my son was not able to control his neck.
We even thought he wouldn't survive.
People could treat him differently and even say unkind things to him.
We had the fear of getting other babies because we didn't know what will happen.
But the condition is manageable.
What I encourage every mother who is expectant is you need to go to your antenatal visits.
Cerebral palsy is a group of disorders that affect movement and muscle tone or posture. It's caused by damage that occurs to the immature brain as it develops, most often before birth.
Cerebral palsy is a condition which causes difficulties with posture and movement for children, and this is because of a disturbance in the brain that occurred either before the baby was born or even after the baby was born.
When Jabali was 1.5 years, he had a major conversion attack, a major one. We even thought he wouldn't survive.
At 6 months, my son was not sitting, my son was not able to control his neck, and there he was so tiny still at 6 months. We had to start the therapies, and the physiotherapies that we started were good.
Karungu has told you he was born with cerebral palsy out of a difficult birth, and I think from then on, I was aware from very early that we might have issues with him because the doctor warned me.
For a mother who, when she's pregnant, she's noticing my child is not moving as often, or the mother is unwell and has a premature baby, so the chances are higher if your baby comes out early. The chances are higher if there's been some abnormal movements that the mother has noticed when she's pregnant, but it's very difficult to tell what the chances are because it depends on what we call the etiology, what has caused that cerebral palsy.
We meet some parents of children living with the condition, parents who at times have been sidelined by the society.
So after going for counseling, I was able just to come out and believe that it's only me who can talk about my son.
We got Jay, we were advised to let him know about his brother from the early age. So when he was growing up, we used to tell him, Toto, you see, we would try to show that Jabali bado ni mtoto, so Jay should take care of Jabali.
Despite the stigma, these parents, Irene Mwangi, Angelica, and Deborah Kioko, are urging the society to embrace people living such kind of disability.
Others will hide their children just because they want to hide. They don't want stigma. I want to tell them there is no stigma in giving birth to a child with disability.
If you are locking the child because you have nothing else to do, that probably I would say it's not really your fault. But if you are hiding them because you're feeling ashamed or something like that, I think that's a very cruel thing to do for both the child and for yourself, because you don't feel free.
I know it's not an easy journey, but the moment you are in denial, even your daughter or your son cannot progress. And also you should let the society know that you have a daughter or a son who has a disability, so that they can embrace him or her.
The diagnosis of cerebral palsy is usually made by the doctor after gathering information about child's problems and doing physical examination. Problems with movement in infancy associated with weakness and stiffness of muscles are important clues, because there are other conditions that could cause problems of muscles, and movement tests may be done. A brain CT or MRI may reveal problems of the brain that may be treatable, according to health experts.
For nowadays, we have IVF treatments where children are being born as twins, and sometimes when you have twin pregnancies, it puts you at risks for having prematurity and even having cerebral palsy. So as difficult as it is to control, but what I encourage every mother who is expectant is you need to go to your antenatal visits. The reason for that, the doctors can be able to detect any problems that you have, because it's not only cerebral palsy we worry about, but if mom has diabetes or has high blood pressure or has even HIV, we need to take control of these conditions, because it gives better baby outcomes. So it's not only for cerebral palsy, but for good baby outcomes, we need regular visits in the antenatal clinic that are available in different counties.
For Deborah Kioko, a mother to a 9-year-old son, Joseph, she had to overcome depression after losing her husband and giving birth to a child living with cerebral palsy.
First of all is to accept. Counseling is about accepting your situation, accepting your problem, and talking with someone to help you bring out the best solution in you. Because that person is not supposed to give you a solution. It's you. So I felt I needed someone to talk to openly, so that I can look at what I can do best for my son. And yes, it comes a time when you say, yes, I'm weak, but I need someone to help me wake up and move.
Major causes of cerebral palsy include meningitis or encephalitis, blood clotting problems, abnormal blood vessels, a heart defect that was there at birth, or a sickle cell disease. Signs and symptoms appear during infancy or preschool years.
So for example, for a baby who's born premature, they tend to bleed in the brain. And because of this, it will cause injuries in what's called the motor, the places in the brain that control motor movement. And this will cause now the signs of cerebral palsy, which is abnormalities in how a child is moving, in the way they are positioning themselves. And so the main causes can be due to anything, in terms of infection, in terms of bleeds, in terms of even brain malformation. And some of these are even genetic driven, and we're still investigating what the genetics is, but those disturbances are the ones that cause cerebral palsy in children.
The children require regular therapy to optimize their condition and also reduce stiffness.
Occupational therapy, kama vile umesikia, ni matibabu ambayo inatumia kazi, more specific kazi za the daily activities, kama tunafundisha how this kid anaweza kujishikia kitu agarau na mkono, aweze kukura, aweze kujiosha, ajifanyie the grooming, na pia kumfundisha kuketi na kusimama ili mwishowe aweze kutembea. And the main goal ya mazoezi ni mtoto aweze kucheza, kwa maana kucheza ndio sasa the activity of a child. na hatimaye mwisho aweze kujitegemea kwa mambo zingine mwisho.
And we have to take care of bone health, because children who are not standing can get fractures of their bones. So we have to make sure that they're taking adequate calcium, because of course if you break a bone that has a major blood vessel, that can cause complications. So we have to manage the complications that come with cerebral palsy, and that way to optimize the longevity and a child living the best life that they can.
Children with mild symptoms can live as long as those without cerebral palsy. The damage to the brain does not become worse over time, but the problems may get more severe as the child grows. With extensive care, symptoms may improve. Health practitioners advise parents to get a therapist who understands the development of a child.
Vile nikikuja kwa mtoto, ninaanzia from since now hajaweza kufeed the chewing, so I start with the chewing muscles. Nafanya the rubbing of the chewing muscles, na facilitate. When I'm rubbing, I'm facilitating the chewing muscles, ndio mtoto aweze kutafuna kitu na kumeza mwenyewe.
Deborah Kioko and other parents started a support group to enable parents with such children meet and give moral support to one another.
At Empress Cerebral Palsy Families Association, we encourage those parents who are at home, who feel that they are scared of bringing out their children, to come and join us, that they will grow so that they are able to bring out their children and be supported.
I always tag along my nanny to go meet the other kids, or when we are going to a children's home where there are kids with disabilities, I tag along my nanny. So in the process, she learns.
Children need to have fun. Take your child out, walk in the garden, take your child to see something so they can enjoy. Childhood is supposed to be enjoyed. So we want even children who have cerebral palsy to enjoy their life. These children have a good future if we support them. We need to know what it is that they want to do for a living. If a child wants to become an accountant and they have the capacity to do so, we support them in the school setting so their future is bright.
In a society full of challenges, such parents want the government to establish a facility that will serve the children with this kind of disability.
If the government could ease the taxes for assistive devices and drugs, make it as in, you see, like how people with HIV get ARVs free. I wish they could do it for kids with disabilities, that the anticonvulsants should be free.
These multiple disabilities seem to have been forgotten, either because they are rare, so there are not too many people, but the government should not forget that they are part of society. They pay taxes for those who work. I've seen many people who sell sweets in the streets. They are not exempted from the taxes that people pay, so they would still require services from the government.
Parents, caregivers, or nannies have also been advised to be patient with such kids. Jacqueline Akoth and Priscilla Mutave are a few examples of caregivers who have lived with such kids for 5 years.
Kwambia yani akitaka kitu anataka, inabidi kwanza umsikilize, umwangalie venye anafanya, ndio urudi tena hiyo kitu ureverse, ndio uchue sasa ni nini anataka, ndio unaenda kumfanyia.
Ni kama anatafuta job. Sasa job yoyote yenye atapata, akikutania mtoto kama huyu Muigai mwenye station yake iko hivi, asitoroke, avumilie tu juu maybe sahi ni kwa Muigai ndiye amezaliwa hivyo, yeye pia kesho anaweza zaa kama huyo.
I know many people, as they call them house girls, and what they give them a bad state of life where they are. That's not right, because this person is a person staying with your kid for the whole day, for a year come, year out. and they are doing it so well and they understand each other, please give that person the respect she demands.
Dr. Susan Wamithi explains that such kids live long when their condition is monitored always by both the parents and the doctors.
For example, for children who have cerebral palsy and seizure disorders, if you're not on your medication or if you're not compliant and following what the doctor instructs, of course, if you get seizures that are ongoing, that can reduce the life expectancy. But most of the times, children, as long as they're being monitored, the doctor is surveying on any complications, because the complications are a result of the injury to the brain.
Cerebral palsy, it's a condition that has left many parents in depression, but health experts say it is a condition that can be managed to optimize the lives of children. Reporting for TV47 from Aga Khan Hospital in Nairobi, my name is Joash Onsare.
Thank you.